Hi, so my name is Christine, and I want to start off with a trigger warning. I'm going to be talking about traumatic pregnancy, birth, and depression, and I'm going to be talking about suicide. And I wanted to make this video in hopes that maybe I can help one person. I know when I was struggling, really what helped me was listening to other women's stories about what they were going through and feeling not alone. That was really helpful for me. So let's start off in the beginning. I found out I was pregnant shortly after Father's Day, and this was a very wanted pregnancy, and it was 4 rounds of IVF. And I did have 2 miscarriages prior. So finding out I was pregnant, I was so excited, but I was also guarded because of our previous losses. So, but I was very excited. And going to the heartbeat scan was nerve wracking. But after seeing the heartbeat, it was so relieving. And then shortly after that ultrasound, anxiously waiting for the next ultrasound, where I found out I was pregnant with twins. And I was in shock and very excited because we prayed so hard for one, we got two, and it was so exciting knowing that I was pregnant with twins, two babies, but also a little scary because I am 4'11", and I was picturing two babies inside my belly, and I was just like, oh boy, like, how's this gonna work? Because I'm small, and I figured I was gonna have a big belly. So I was, a little bit scared of that, but very excited. I will say pregnancy after loss is very nerve-wracking. You're so excited to be, creating this life, also scared because you have losses. And before every appointment, I was really scared. I really couldn't even look at the screen. I was just praying every time that there would be a heartbeat on both babies. And, after knowing that I was having twins, I was immediately looking at baby things and nursery and stroller and everything in two, double the price, but double the love. And unfortunately, my dreams were shattered pretty early on. At like 12 weeks, I found out that one of the babies had a lethal brain condition on top of another one. Baby B had exencephaly, which is a lethal brain condition, neural tube defect, and also she had spina bifida. And we found out that baby A was okay. And, it was so scary knowing that our one baby wasn't going to make it. And that was the beginning of a very difficult journey for me. And it was very hard. I passed out as soon as the doctor told me. I remember like it was yesterday, him telling me that our one baby will not survive. 100%. No one has survived this, from what he has said to me. I've never even heard of that at that point. I didn't know what it was. He said it was a neural tube defect, and I was so confused because I was taking a good amount of folic acid, and I started a year before trying to even get pregnant. So I was on folic acid for a long time. And finding out about our baby was devastating. And after that appointment, I had to be followed up with CHOP, and because they wanted to basically monitor baby B's brain, and they wanted to do anatomy scans. So A few weeks later, I went to my appointment and I found out more devastating news. There was a few other issues that happened. The membrane separating, the girls ruptured, and they were now in one placenta, one sac. So I had mono twins, which is very rare. And then there was also severe cord entanglement. Their cords were wrapped around each other. Also, baby A had a heart block. And, uh, it was just insane. I felt so sick. I was so depressed already with the knowing that our one baby wasn't going to make it. And now knowing that our other baby has a heart block, I had to start on steroids. And I found out that I would be admitted at 24 weeks because mono twins are, it's dangerous because of the cord compression, the entanglements. There are a lot of risks that can happen with that. And there are risks of mono twins is it's called TTTS, which is like a twin. I don't even know. It's like their blood mixes and it causes, neurological issues. And it was pretty, traumatizing, and it was hard to keep everything together. I was really depressed, and I did see a psychiatrist and a therapist at the time, and they were trying to help me with dealing with what I was going through, and I was put on a medication. I will say, like, for me it didn't help, but I know it helps other people, but for me it didn't help, and I was put on Zoloft, and I found that it didn't help me at all. But I was still seeing a therapist and trying my best to stay positive. I was really praying that I could, make it through and be as positive, because I know if I was negative, it would affect the babies. I also found out that we were having girls, and I knew immediately what we were going to name them: Sophia and Claire. And I knew I was having girls from the very beginning. I didn't even pick out baby names or for boys because I just knew that we were having girls. So then I was admitted at 24 weeks, and that was a complete crazy journey again, to start another journey. I was going to be spending 24 hours a day in my room and getting monitored. The girls would be monitored like multiple times a day for an hour each time. And it was very hard to get the girls on the monitor because they were so active and moving around. So, I was on the monitor literally just all day long. So I would eat, be on the monitor, eat, be on the monitor, and not sleep that much, because you were basically, the nurses would come in the middle of the night to check your blood pressure. So I was like really rarely sleeping. And the few things that happened when I was admitted that was scary was, years ago in 2019, I had a laparoscopy procedure because I was having like pelvic pain, and my OB thought I might have had endometriosis. So I had a laparoscopy procedure, and I did have endo stage 2. So he removed that. And apparently, if you have a laparoscopy, it can increase your chances of getting placenta accreta or placenta, the other one. Basically, like your uterus is like growing differently. I don't even remember, to be honest, but it's not good. So I had to have an MRI when I was pregnant to make sure I didn't have these conditions. Thankfully, I didn't. But the next problem is that I have an IgA deficiency, which means I cannot get a blood transfusion. I can only get red packed blood cells. This is also a very confusing autoimmune disease. And there was debates back and forth. Some people said I can get it. Other people said I can't. So I had to be transferred to another hospital that basically carries red packed blood cells. So I was admitted at 27 weeks at another hospital. And it was definitely a scary experience being in there. The room was a lot smaller and the food was awful. The machines were old looking, which was surprising because this hospital that I was at is basically like the most well known hospital in the country. So I was like confused by the elder machines. But same thing, I was monitored all day long. I was extremely grateful for all of the care I was getting. The nurses, the doctors were pretty much all incredible. And I was a mess mentally. I was just praying that Sophia, she's the one with exencephaly, I was praying that she was going to live for at least an hour. I just wanted to meet her and hug her and love her. I was praying for that, and I really thought that was going to happen. But at 28 weeks, she passed away. That day, around 2 o'clock, I noticed that I didn't feel movement. And, I thought maybe, she was sleeping or whatnot. So luckily, like just in time, like when I was feeling that she wasn't moving, one of the resident doctors came in and did an ultrasound, and I knew immediately that she passed. She wasn't moving. I didn't see her heart beating, and I was alone. My husband was at work, and I couldn't even call him because I was not well. So the resident had to call him and tell him that Sophia passed, and I'll forever be remorseful that I wasn't the one to tell him. I couldn't even breathe. I was so broken, and the doctor came in and basically wanted to do a C-section because Claire's heart rate was going up and my blood pressure was going up. So very shortly after I had a C-section, I will say the C-section itself was okay. It was a weird feeling. It did feel like every organ was removed of my body. It literally felt like my lungs were being removed. It felt like it was all up here for some reason. It was very weird. I shook a lot. And I can't even tell you, I felt like it was on another planet. It was nerve-wracking because, Sophia passed and we were worried about Claire. But thankfully, right away, the NICU doctor came in and said Claire was breathing on her own and she was put on CPAP, room air, which is pretty remarkable for a 28-week baby. And just hearing that she was doing well was really relieving. It was also devastating because Sophia passed. It was such like a roller coaster of emotions. After the C-section and they put my organs back in place, I was sent to recovery and I was told that I could see Claire when I could walk to the wheelchair. So as soon as I could, I, when everything wore off, I got up and it felt like the organs came out of me. I've literally never been in this much pain in my entire life. And let me tell you, my appendix ruptured once, and this was 20,000 times worse. It was awful, but I made it to that wheelchair and we went up to see our baby, and it was so relieving to see her. We did find out at that time that there was a potential brain bleed, which was terrifying, and she was on lights, and thankfully she didn't have a brain bleed. But that was the beginning. That was the first day of our NICU journey, which is another crazy story. But after we saw Claire, we went back to our room and I spent 4 days seeing Claire and spending time with Sophia. And I'm really grateful for the time that I spent with Sophia. And I just wish I could hug her again. Oh, man. She was beautiful. Oh, she was so beautiful. Her hands were so beautiful. Her skin was just so soft, and I'll never forget that. After 4 days, we went home, and it's weird going home without your baby, let me tell you. But basically, long story short of this NICU journey, which is another story, there's been so much that happened to Claire. She was in 2 NICUs and in another hospital, which was like a rehab hospital for feeding, because she struggled with feeding and she was sent home on an NG tube. She refused to eat orally. But her first day home was one of the happiest days of my life. And I started to spiral, though, with my postpartum depression. I knew that I was having depression. Like I had depression when I was pregnant with, Sophia's diagnosis. And then when I came home, the only thing that I was thinking about was that Claire would be better off without me, and that I needed to be with Sophia. And I thought of that all day long for a long time. And it was getting worse and worse. And they just get increasing my Zoloft. And then I was put on Buspar, and that was being increased a ton. And I was at the max doses for both of them. And I felt worse and worse every day until I, reached one day where I knew that I needed help immediately. I just wanted to die, and I was thinking of ways to end my life. And I remember telling my husband that I needed to go to the hospital that day. I couldn't wait. So he came home from work, and I went to the hospital. And I think that was one of the best decisions that I made. I had a really, the best experience that I could have had. And I was put on a medication that helps me. And I felt a lot better pretty quickly, actually. And I was then in intensive outpatient therapy for a few months. I was going a few times a week for 3 hours, and I really found that really helpful. I also did support groups. That was really helpful. I was, looking up postpartum depression stories on YouTube and listening to other people's stories. Some women, unfortunately, that I saw didn't make it, and a lot of the women that I saw that didn't make it had a very similar experience with the medication journey that I had. And I'm forever grateful that I was able to recognize that I needed help. And I will say, it's September. I was in the hospital in April, and from April to September, I feel like I have slight improvement every single day. And I no longer feel that Claire would be better off without me. I know that she needs me, and my family and friends need me. And I want to be with Sophia, but I'm not ready yet to leave this planet. I know she's with me. I have had many signs that she is with me. There's, I don't know if anyone will believe this, but there's been signs on her little urn. She has 3 doves, and I see 3 doves all of the time. Also, our TV sometimes goes on and off, and that's never happened before. When we were in the NICU with Claire, the paper towel dispenser would always go off, and the faucet, this is the big one, the faucet would go on and off. And I just felt the presence of Sophia. And I know that she's with us. I wish she was here on earth, um, but I know she's watching over us. And, you know, as the days go on and I'm seeing improvement, of course, every day is not perfect. I do struggle with anxiety, with this passing of Sophia. Sometimes I worry, like Claire, like, she has a feeding tube right now. Like, is something going to happen with the feeding tube? Or, she's thrown up a lot. She's, some stomach issues, and she's choked on her throw up, and I get scared about that. But I'm really trying to, do the best that I can. I can't do more than I can. I'm doing the best that I can. And I'm trying to get as much support as I can that I can get from my family and friends and from my husband. And I just hope that, one day my story can maybe help someone. There's been a lot of things that have happened in between all of that. For example, 2 weeks after Sophia passed, our dog of 12 years passed away. And that was awful. Oh, goodness. And then when my dad left from seeing Claire in the hospital, he fell down the steps at the hospital and broke his leg and his arm. And, you know, and then I was on a pumping journey. Although I wasn't breastfeeding, I was pumping every 2 hours. I wasn't making milk, and then I had to be on medicine to increase my milk supply. And I was pumping and power pumping, and you know, it was just such a journey. And I know my journey is not over, and every day is a new day. But I am hoping that I can help someone. And, if anyone ever, wants to talk or vent, I know other women go through this. Please message me. I, want to help and share my journey. I want to listen to yours. And, yeah, so off to another day and another journey.